As we look ahead to February and American Heart Month, St. David's Healthcare wants our community to understand how important it is to know CPR. More than 350,000 cardiac arrests occur outside the hospital each year in the U.S., and according to the American Heart Association, about 90% of people who experience an out-of-hospital cardiac arrest don't survive. Fortunately, if bystander CPR, or CPR that's performed by someone other than a working medical professional, is administered immediately after cardiac arrest, a person's chances of survival can double or triple. Here's Dr. Amin Al-Ahmad, an electrophysiologist at the Texas Cardiac Arrhythmia Institute at St. David's Medical Center and a board member of the American Heart Association, to explain why it's important for everyone to know CPR.
Bystander CPR is exactly what it sounds like. In other words, when a bystander or a non-medical person comes upon somebody who has had a cardiac arrest, then they can initiate CPR. So it's a little different in that sometimes bystander CPR does not require mouth-to-mouth breathing, but chest compressions would be adequate. Pretty easy for people to learn and pretty easy for people to do. And people who have a cardiac arrest outside the hospital have a very high mortality rate, and we can reduce that mortality rate by having bystander CPR. There was a recent study in 2014 that suggested up to 45% of those folks would survive. Now that's compared to data that suggests if you don't get bystander CPR, 5% or less survive. So it's a big difference in terms of survival if bystander CPR is utilized. It's especially important for women to learn bystander CPR because the mortality rate for women is a little bit higher. It's important for women to know this, to understand this, and to perform it when necessary. Sometimes people are a little hesitant or a little bit afraid to perform bystander CPR. They're afraid because they're worried they might hurt somebody by doing chest compressions. But I would usually tell people not to worry about that. Those patients, if you don't perform bystander CPR, really have a very, very high mortality rate, a very low survival rate. You're really their best option. There's a lot of different options to learn bystander CPR. One would be through the American Heart Association. You can look at City of Austin and some of the surrounding counties offer classes. For example, I've had my kids and my wife, all who are essentially bystanders, trained in CPR, and I think it's very important and valuable. Yeah, the more people that learn bystander CPR, the better. I think we all should try to learn bystander CPR. It's going to improve survival, it's going to save lives in the area, and will make the City of Austin a better place, because if somebody does have a cardiac arrest, there will be people around to help save their life.